First aid. If an accident occurs in the wilderness, it will be your responsibility to deal with the situation. The specific sequence of actions when dealing with this situation is: 1. Remain calm, providing your patient with quiet, efficient first aid treatment. 2. Keep the patient warm and lying down. Do not move this injured person until you have discovered the extent of the injuries. 3. Start mouth-to-mouth artificial respiration immediately if the injured person is not breathing. 4. Stop any bleeding. 5. Give your patient reassurance. Watch carefully for signs of shock. 6. Check for cuts, fractures, breaks and injuries to the head, neck or spine. 7. Do not allow people to crowd the injured person. 8. Do not remove clothing unless it is imperative. 9. Decide if your patient can be moved to a proper medical facility. If this is not possible, prepare a suitable living area in which shelter, heat and food are provided. Shock. Shock is a depression of all of the body processes and may follow any injury regardless of how minor. Factors such as hemorrhage, cold and pain will intensify shock. When experiencing shock, the patient will feel weak and may faint. The skin becomes cold and clammy and the pulse, weak and rapid. Shock can be more serious than the injury itself. Use the following method to prevent and control shock. 1. When treating injuries, I restore breathing. 2. Stop bleeding. 3. Treat breaks and fractures. 2. If there are no head or chest injuries, place the patient on his or her back with the head and chest lower than the legs. This will help the blood circulate to the brain, heart, lungs and other major organs. 3. If severe head and chest injuries are present, elevate the upper body. If chest injuries are present, elevate the injured side to assist in the functioning of the uninjured lung. 4. If the injured person becomes unconscious, place him or her in a face-down position to prevent choking on blood, vomit or the tongue. 5. Keep your patient warm and under shelter. Stopped breathing. If breathing has stopped, begin mouth-to-mouth resuscitation. Place the patient on his or back and follow these steps. 1. To open the airway, lift the patient's neck and tilt the head back. 2. Keeping the neck elevated, pinch the nostrils to prevent air leakage. 3. Place your mouth completely around the victim's mouth and blow, watching for chest expansion. 4. After removing your mouth, listen for air leaving the patient's lungs and watch for the chest to fall. Check for an airway blockage if the chest does not rise. Repeat these steps approximately 12 to 15 times per minute. If treating a child, cover the nose and mouth with the mouth. Use a smaller puff. So and repeat these method 20 to 25 times per minute. Bleeding. To control bleeding, elevate the wounded area above the heart and apply pressure using either gauze, clean cloth, dried seaweed or sphagnum moss. Use pressure at the pulse point between the injured area and the heart if bleeding fails to stop. If bleeding still persists, use a tourniquet between the injury and the heart. This method should only be used in extreme situations. After bleeding has been controlled, wash the wounded area with disinfectant and apply a dressing and bandages. Fractures. A fracture is classified as either a simple closed or compound open. Signs that a fracture is present include: 1. Pain at the affected area. 2. The area may or may not be deformed. 3. The victim is unable to place weight on the area without experiencing pain. 4. A grating sensation or sound may be present during any motion of the injured area. Treatment is as follows. 1. If in doubt, treat the injury as a fracture. 2. Splint the joints above and below the fracture. 3. If the fracture may penetrate the skin, it could be necessary to apply traction to straighten the deformity. 4. Be sure to pad your splints. 5. Check the splint ties frequently to be sure they do not hinder circulation. 6. Cover all open wound with a clean dressing before splinting. Dislocation. Dislocation happens when the ligaments near a joint tear, allowing the movement of the bone from its socket. It is unwise to treat a dislocation unless you are a trained professional, as permanent damage may occur. The affected extremity should be supported using a sling or other device and pain controlled with aspirin or other suitable drugs. Sprains. Treat sprains by applying cold to the area for the first 24 hours, then once the swelling has subsided, let the sprain sit for a day. Apply heat the following day to aid in the healing process. The sprain should be splinted and rendered immobile until the pain has completely disappeared. Concussions. Concussions or other head injuries are often accompanied by a leakage of watery blood from the nose or ears. Other symptoms may include convulsions, an unresponsiveness of the pupils or headache and vomiting. Keep the injured party warm, dispense a painkiller regularly and allow time for the body to rest and repair. Heat exhaustion. Heat exhaustion is not uncommon when water is not sufficient. The body becomes dehydrated and salt depleted, resulting in nausea, faintness, a weak, rapid pulse and or cold and clammy skin. Treatment includes plenty of rest, liquid and salt tablets. Sunstroke. Sunstroke may occur when the body is exposed to excessive sun. The body becomes overheated and provides too much blood to the circulatory system, resulting in a flushed, hot face, rapid pulse, headache and or dizziness. Treat sunstroke by resting in a cool area and applying and consuming cold liquid. Prevent sunstroke by wearing proper headgear. Muscle cramps. Muscle cramps occur when the muscle accumulates excessive lactic acid or a loss of salt through perspiration. Treatment includes resting, deep breathing and stretching. Restore the salt balance immediately. Burns. Burns are most commonly followed by shock. Administer a pain reliever immediately, apply gauze covered in Vaseline to the affected area and bandage. The patient should consume more water than usual. Snowblindness. Symptoms of snowblindness include scratchy or burning eyes, excessive tearing, sensitivity to light, headache, halos around light and temporary loss of vision. Bandage the victim's eyes and use cold compresses and a painkiller to control the pain. Vision will generally be restored after 18 hours without the help of a doctor. Always wear snow goggles or sunglasses in snowy areas to prevent snowblindness. Frostbite. Frostbite occurs when the tissue of an area, most commonly the toes, fingers or face, is frozen either from direct exposure to the elements or high wind. First-degree frostbite turns the area cold, white and denumb. When heated, the area becomes red and can be compared to a first-degree burn. A blister will form after warming with second-degree frostbite. Dark skin, gangrene, and a loss of some skin and tissues is common in third degree. Fourth-degree frostbite causes irreparable damage. The affected area will remain cold and lifeless, and generally a part of the area is lost. With adequate clothing, frostbite can easily be avoided. This concludes video 3. Please check back for the last video of this 4-part overview series.